Urgent public alert. Human metapneumovirus cases reported in India. India stands at a critical juncture with 9 confirmed cases of human metapneumovirus, HMPV, reported as of January 11, 2025. As a nation, we must act swiftly and responsibly to prevent a potential health emergency. This is an urgent message to the public to stay informed, vigilant, and cooperative in combating the spread of this virus. HMPV, a respiratory virus that primarily affects children and at-risk populations, has been reported across several Indian states. Karnataka, 2 cases recorded in Bengaluru involving infants aged 3 and 8 months. Maharashtra, 2 suspected cases in Nagpur are under close observation. Gujarat, a single confirmed case in Ahmedabad. Tamil Nadu, 2 cases identified, 1 each in Chennai and Salem. Assam, the youngest confirmed patient so far is a 10-month-old from Dibrugarh. The child was admitted to Assam Medical College and Hospital, AMCH, with cold-like symptoms but is now stable. This brings the total tally to 9 confirmed cases in India, a number that warrants our immediate attention. Health authorities in Punjab and Delhi are proactively addressing the potential risk to prevent the spread of HMPV. Punjab. No confirmed cases have been reported thus far. Health Minister Dr. Balbir Singh has assured the public that the situation is under control while urging residents not to panic. The state has readied hospital beds, ventilators, and testing facilities to handle any unexpected rise in cases. Delhi. No HMPV cases have been identified, but proactive measures have been initiated. Hospitals are required to swiftly report influenza-like illnesses and severe respiratory infections, enforce isolation protocols, and maintain the availability of essential treatments and oxygen. While Punjab and Delhi have not yet reported cases, preparedness is key to avoiding potential outbreaks. HMPV symptoms often resemble the common cold, making it easy to dismiss. However, watch out for persistent cough, fever, runny or congested nose, sore throat, fatigue. In severe cases, especially among young children, the elderly, or those with pre-existing conditions, it can lead to complications like pneumonia or bronchiolitis. The virus spreads through respiratory droplets from coughing, sneezing, or close contact with infected individuals, similar to other respiratory infections. Surfaces contaminated with the virus also pose a risk if touched and followed by contact with the nose, mouth, or eyes. Infants and toddlers. Elderly individuals. People with weakened immune systems. Those with chronic respiratory illnesses like asthma. These groups must take extra precautions to avoid exposure to HMPV. It is essential to understand that at present there is no specific antiviral treatment or vaccine for HMPV. Most infections are mild and resolve on their own with symptomatic care, including adequate hydration, rest, over-the-counter medications to reduce fever and alleviate cough. For severe symptoms, especially in vulnerable groups, hospitalization may be required for supportive treatments, such as oxygen therapy and, in rare cases, ventilator support. Your role in preventing the spread of HMPV is crucial. Follow these simple but effective steps diligently. Practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or touching your face. Wear masks. Cover your nose and mouth in crowded or closed spaces to reduce the risk of inhaling infected droplets. Cough and sneeze etiquette. Always use a tissue or the inside of your elbow to cover your mouth and nose. Dispose of tissues immediately after use. Avoid close contact. Maintain a safe distance from those showing symptoms of respiratory illness. Refrain from sharing utensils, towels, or drinks. Disinfect commonly touched surfaces. Regularly clean doorknobs, tabletops, phones, and toys to minimize contamination. Monitor symptoms. If you or someone in your family exhibits prolonged cold-like symptoms, seek medical advice without delay. The Indian government and healthcare authorities are on high alert to contain the progression of HMPV. Here are the key steps being undertaken. Strict monitoring of influenza-like illnesses and severe respiratory infections through hospitals and clinics nationwide. Guidelines issued for isolation protocols in healthcare facilities handling respiratory cases. ensuring the availability of diagnostic kits, medications, and oxygen. Public awareness campaigns promoting crucial preventive measures. These initiatives, while robust, require the collective support and cooperation of the public. Let's address the most pressing concern bluntly. As of now, no fatalities due to HMPV have been reported in India. While this information is reassuring, it should not lead to complacency. HMPV remains a cause for concern due to its potential to impact vulnerable groups severely. Officials emphasize that the situation is under control, with no significant surge in cases recorded. However, the virus's unpredictable nature necessitates vigilance. Acts of prevention are far more impactful than reactions to a full-blown outbreak. Each small action counts, from wearing masks to sanitizing your hands. This virus does not just affect individuals. It can burden families, communities, and the healthcare system at large if allowed to spread unchecked. By adhering to the recommended guidelines and staying informed, you are not only protecting yourself, but also safeguarding the at-risk members of your community. Awareness is the first and most critical step in overcoming this challenge. To every citizen of India, the fight against HMPV cannot succeed without you. Share this knowledge with your family, friends, and neighbors. Keep an eye on your health, follow preventive measures, and support local health authorities in their efforts. This is not a call to panic, it is a call to act responsibly. Together, with vigilance, awareness, and empathy, we can prevent the spread and impact of HMPV.